Hair transplants. What are the risks and side effects? This is something that's very important to know if you're considering a hair transplant. So let's break it down first into side effects and then into risks. The side effects of a hair transplant most commonly are swelling. Everyone swells to some extent. The swelling can start around the forehead, can proceed to go down and surround the eyes. But guys, the swelling is harmless. It doesn't affect the outcome of your surgery and it will go away in about 7 days. The other side effect of a hair transplant is folliculitis. Folliculitis is pretty much ingrown hairs. As those hairs start to breach the skin, some of them become entrapped and inflamed, and they can form little pimples. This is usually self-limiting, which means there's nothing you really need to do about it, and it's going to go away by itself. Now let's talk of risks. So while this is a low-risk procedure, there still are some risks. The greatest risk in a hair transplant is the use of local anesthesia and local anesthesia toxicity. So if you go somewhere where they're not expertly titrating the amount of local anesthesia used to numb you, the result of that could be a very rapid and acute death. So really beware of where you go. Typically, this doesn't happen if you go to a reputable doctor who knows what they're doing. Another risk of hair transplant is patient risks. So let's say you're diabetic or a smoker, you're at higher risks of things like infection and skin necrosis just because of poor healing. And that brings me to my last two risks, which is infection. So anytime we breach the integrity of the skin, there's always a risk of infection, although in the scalp, it's so highly vascularized, which means it's got such a good blood supply that infection is so rare. But if it's not done properly in a sterile environment, infections can still happen. And then the last risk would be the risk of skin necrosis. And that's when a piece of skin literally loses its blood supply and completely dies off, leaving a nasty scar in that area where hair does not grow. What causes this? Well, 3 different things. Number 1, if that doctor uses too much adrenaline in the area to help prevent you from bleeding, that could cause necrosis. If they try please you way too much and they go way too dense with their incisions, that can cause the piece of skin to die off and necrosis. And number 3, if they go too deep in their incisions, that can also cause necrosis. So I hope that helps you. These are the major side effects and risk factors. If you want to know more, make sure to ask and stick around. I'm going to do my absolute best to try and answer everything.